This video will discuss about various blood products. So first of all, when we take the Westergreen's tube and we see that this is the cellular component, that is the RBCs, and this is the plasma. Plasma forms around 55% of the blood and the cellular is 45%, and this middle region is the Buffy code. Now as I proceed further, you all must know that there are components of blood. Okay, so components of blood such as RBCs, all the cells, then the plasma, all right, and then certain proteins. Okay, sorry, this much, and the whole blood, all right. So first of all, in RBCs, we will have packed red cell substitutes. But coming on to the plasma, now this plasma, by plasma, what we can get is cryoprecipitate, fresh frozen plasma. Okay, then we can get factors 9, 8. Okay, then whole blood. Also proteins. Now in proteins, we have the albumin and the globulin. All right, now globulin is also important, albumin is also important. I'll tell you their importance as further we proceed. So first of all, coming on to the first blood product that we will discuss is the packed red cells. Okay, so the first product that we will refer to is the packed red cells. Now these are usually given in anemia patients. Now how is it formed? In this 2000 to 2300 grams of the blood, it is basically centrifuged for 15 to 20 minutes. Then we remove the plasma out of it and we get the plasma packed red cells. This is also given in old age. Now, it should be avoided in patients who are suffering from congestive cardiac failure and renal failure. Then the second one we will discuss about is plasma. Now, plasma can be given in patients of burns, hypoalbuminemia, or where there is severe protein loss. Then we will discuss about human albumin, 4.5%. This is a very favorite question, and this is given in which patients? You must remember this. It is given in burns patients. Okay, so this is what you need to remember. This is basically done when the blood is again centrifuged and then it is actually stored for several months in the liquid form for at the temperature of 4 degrees Celsius. All right. Then coming on to the fresh frozen plasma. Now, what is fresh frozen plasma? Now, in this, what happens is there is fresh plasma, right? This plasma, then it is rapidly frozen and it is stored at a temperature of minus 40 degrees Celsius. Now, this is usually given in surgeries where the patient has severe renal failure or liver failure. Patients who have severe renal failure or liver failure. Also, it is given in specific receptor deficiencies. Then coming on to another one, which is the platelet concentrate. Now this is given in thrombocytopenia. Okay. Then coming on to the cryoprecipitate, which I told you before as well, precipitate. Now this is a very rich source of factor 8 and fibrinogen. So it is used in DIC patients. Okay. Then is the factor 8 and 9 concentrate. So this is given in hemophilics and Christmas disease. Then another one is the fibrinogen, again given in thrombocytopenia. Then platelet rich plasma. Now this is basically when we centrifuge the plasma, then we get this. Basically we centrifuge around 150 to 200 grams for 15 to 20 minutes again, and then we get this. This is also used in platelet disorders. Then very important is the SAG-M. Now in this everything stands for a word. S stands for sodium chloride, A stands for adenine, G stands for glucose and hydrate, M stands for mannitol. So this is basically given in patients who are suffering from anemia, and this is very advantageous because in this the viability of the cells is quite a lot. First of all, one unit is basically 4 units of Sagem are given for replacement of one whole blood. Then later 2 units are given. Okay. Now there are certain more factors that we will discuss about, such as IV immunoglobulins. So these are basically given to prevent the infections in patients of ITP and PTP. Then there is granulocyte concentrate. This is given in severe neutropenia. Then leukocyte poor blood. This is given in patients who require multiparous females, basically who require multiple transfusions. Now we also discussed it in the complications of blood transfusion, that there occurs a febrile reaction and it can be minimized by giving the leukocyte depleted blood. So this is the same thing. Now these are all the products which are derived. Now there are certain synthetically derived solutions as well. So synthetically prepared solutions. Now in this, first of all, we will discuss about dextran. So dextran is basically a polysaccharide which is taken from Leuconstock mesenteroides species and also yeast extraction. Now there are two types. One is the dextran 70 and one is the 40. Now in this stands for the molecular weight. This one is basically very important because it inhibits the red cells sludging. Also it promotes the Rolex formation. Then it interferes with the platel function. Then this one is having the weight of 70 molecular weight. Now this one has a longer effect. Okay, now basically what they do is they do plasma volume expansion. So they are plasma volume expanders. Then there is one more compound which is gelatin. Now it is having a reduced efficiency than the dextran, but it is also having the same function. Then we have hydroxyethyl starch. Now this is formed basically when the starch is treated with ethylene oxide and NaOH. This is chemically inert and it comes second in the efficiency rate after dextran. Then there are certain fluorocarbons. Now these are very important because they act as the substitutes to red cells, and normally the red blood cells, they passively absorb the oxygen, but what they do is they basically bind and release the oxygen. Then there are also emulsions of fluorocarbons